New tonight, fentanyl is dangerous enough in the unregulated opioid supply, but another alarming substance is still ravaging Pennsylvania and much of the country. Xylazine, often referred to as the zombie drug, causes severe and unique side effects. I spoke with a UPMC doctor tonight because UPMC is one of the first health systems to come up with guidelines for treating patients with wounds the drug causes. Xylazine is not an opioid. It's an animal tranquilizer, turning up more and more in illegal opioid drugs.
Here in Pennsylvania and in Western Pennsylvania, we've been seeing xylazine mixed in with fentanyl and heroin since 2019. So Pennsylvania has been the epicenter of xylazine adulteration for our patients.
UPMC doctor Ragini Jawa says many of their patients didn't know xylazine was in their drugs. It's called tranq when mixed with opioids like fentanyl, which puts people at risk of more than an overdose. UPMC doctors keep seeing patients dealing with zombie-like symptoms and complications.
Cause them to be very sleepy for long periods of time. And some people are at risk of developing dependence and withdrawal from this drug that they were never intending to use. Some of them are at risk of developing these necrotic, painful ulcers or wounds.
She says it's important doctors can identify the cause and start treatment as soon as possible.
If they do not start getting wound care early enough, then they can develop infections, and sometimes they can progress into needing amputations.
Dr. Jawa says doctors need to be ready to take care of these patients. At UPMC, they saw the urgent need for a hospital-wide playbook and created a team of specialists.
From addiction medicine, hospital medicine, toxicology, infectious disease, nursing, wound care, plastic surgery all came together.
They developed and implemented detailed protocols to better care for people who come into the hospital with xylazine symptoms and wounds.
Withdrawal management for xylazine, testing on who needs to get xylazine testing and who does it, and then finally to try to streamline how we provide medical wound care for these patients.
The UPMC team published their guidelines in the Substance Use and Addiction Journal to share the easy-to-follow roadmap for other hospitals to use. Dr. Jawa says many hospitals in PA are now employing similar protocols.
If our health centers are not up to date with the changing drug supply, it can be really frustrating for people in the community who are trying to get the help, but they don't necessarily have their withdrawal managed or their pain managed or their wounds managed.
Now, naloxone will not reverse the effects of xylazine, but since it's often mixed with opioids like fentanyl, Dr. Jawa says naloxone should still be given in response to any suspected overdose. And people who need help starting their recovery journey can turn to Prevention Point Pittsburgh. It's a local harm reduction organization, and UPMC has outpatient addiction centers, including the Recovery Engagement Program at UPMC Mercy.